Unlike a 4-star hotel or an Airbnb, nobody likes to stay in the hospital. If you've ever stayed in a hospital for any length of time, you know it's not the most comfortable place in the world. So even before the pandemic, approximately 36 million people were admitted to the hospital each year. Most of these were dealing with issues such as acute trauma or acute medical illnesses like heart attacks or strokes. Another reason for being admitted to the hospital is exacerbation of chronic illnesses such as congestive heart failure, diabetes, renal insufficiency. And in addition to this, you can have things like infections, acute illnesses such as pneumonia. When it comes to our health, there are certain things that are just out of our control. So there are things like our age, environmental factors, and also our genetics. But some things we can control, and that's why I made this video. So if you stick with me, I'm going to give you 5 things that you can actually do to help stay out of the hospital. And before I forget, if you like this video, if you like the material, or if you like the way that I present it, hit the like button, or better yet, hit the subscribe button. I'd appreciate it. Okay, the first step that I recommend is to see your primary care doctor on a regular basis. So making regular trips to your PCP can make sure that you're on top of things, especially if you have chronic illnesses. He can make sure that these are under good control. As you might expect, some of the conditions that can land you in the ER and subsequently the hospital are going to be things like strokes and heart attacks. So what we need to do is we need to work on the risk factors for strokes and heart attacks. So what are these? High blood pressure, high blood sugar, i.e. diabetes, high cholesterol, and if you're smoking, you need to stop smoking. And if you already have one of these conditions, high blood pressure, high cholesterol, diabetes, this is where going to your PCP on a regular basis is really key. He or she can actually help you control these tightly so that your chances of having a stroke or a heart attack are diminished. Next, if you have a chronic condition, you need to know what signs and symptoms to look for, which could indicate that you may be getting into some trouble. So for instance, if you have congestive heart failure, what signs and symptoms do you look for which kind of tip you off that, hey, you need to get things under control or you're going to end up in the hospital? And that's just one example. There are thousands of diseases out there. So if you have a disease, know exactly what to look for that might indicate that, you're going down the wrong path or that your chronic illness is not being well controlled, which would make you more prone to ending up in the hospital. Next, if you were discharged recently from the hospital, they gave you instructions to follow up with your primary care doctor. This is hugely important. You need to do this. Studies have shown that 1 in 5 patients are readmitted to the hospital within 30 days for this exact reason. And regarding hospital discharge and readmission to the hospital, one of the best things you can do to help prevent this is to make sure that you are straight on exactly what medications you should be taking. This is the biggest problem that I see on patients who have just been discharged from the hospital. And if you have to, refuse to be discharged until your medications are straightened out. Someone has sat down with you and gone over your admission medications and your discharge medications. What's different and why? Don't leave until you get this taken care of. Okay, next, take your medications like you're supposed to. I know nobody likes to take medications, but you're probably taking medications for a reason and you probably need them. So unless you've discussed this with your doctor and he says, okay, you can stop the medication, stay on your medications. And also don't forget, there are a lot of medications that you might be taking that interact with other medications negatively. So before you take anything, especially over the counter, make sure that you discuss this with your primary care doctor. And just as a general rule, if you're taking anything over the counter, just let your doctor know, just so he can have it in your chart and he can let you know if it's safe to take with all the other medications that you're taking. And staying on the topic of medications, sometimes you're given a medication, you start taking it, and you feel better. So you stop taking it. Don't do this. If you do want to stop, again, discuss with your primary care doctor. He may say, yeah, go ahead and stop it, or yeah, it's reasonable, or you don't need it anymore. Don't just stop it on your own though. Have you recently had an outpatient procedure or maybe a surgery? A lot of admissions to the hospital are done after having had a procedure or surgery and having had complications from these. What you need to do is you need to know exactly what to look for after having a procedure or surgery that might indicate that you're getting into trouble, i.e. infection. So what do you look for? So you need to know that, hey, when you get home, you need to monitor for redness, for swelling, for increased pain, for drainage, for pus. Awareness is 90% of the battle. Or what if you get home and the incision looks okay, maybe a little bit sore, but you have fever, You have headache. You have nausea. You have diarrhea. What does that mean? You need to know all of this before you head home. Okay, next, did you know that millions and millions of patients, usually elderly patients, are admitted to the hospital after having had a fall? So as we get older, our equilibrium, our balance, our strength, all of those wane. So whether it's a curb, a step, uneven ground, or heck, even if you're picking up something from the ground, be mindful that you are apt to fall. Be very careful. Make sure that your feet are planted firmly on the ground. And if you need to pick up something, don't. Ask somebody else. If you need an assistive device, like a cane, a walker, make sure that you use it. And I'm not telling you anything new, but as we become older, we become more fragile, more brittle, less limber, weaker. So knowing this, what can we do to help prevent hospital admissions from having a fracture? The single best way to stay out of the hospital is to stay healthy in the first place. This includes a healthy diet and exercise. So what you want to do is cut down on the processed foods, eat lots of whole grains, lean proteins, also fruits, vegetables. These types of foods help feed your body what it needs: the vitamins, the minerals, the nutrients, the antioxidants, the healthy proteins and fats. Plus, eating healthy like this, especially combined with a low sodium diet, can help control your blood pressure and also your cholesterol, which can help stave off things like heart attacks and strokes. Additionally, if you're eating like this, you're probably going to lose a little bit of weight, which will probably help with things like joint pain, low back pain, knee pain, hip pain. Not to mention that a healthy diet like this, if you have diabetes, can also help control your diabetes. Next comes the exercise. So if you combine this with a healthy diet, you're on the right track. And when I talk about exercise, I'm not asking you to go out there and run a marathon. I'm just asking that you become more active. And little simple things can help your case. So maybe parking a little bit further out in the parking lot, or instead of taking the elevator, take the stairs. Things that you can do, maybe join a gym, maybe get on a recumbent bike, or ask a friend of yours to go for a walk or walk your pet, do something, increase the activity level. And many people opt for a low impact cardio workout like swimming. This is great. And when it comes to strength training, even the littlest amount of resistance is going to help. Whether it's a small dumbbell, resistance bands, this is going to help you. Ultimately, everybody can improve their chances of living a longer, healthier life, and also help prevent hospitalization if they diet and exercise. So we can't control everything. We can't control our age, we can't control our genetics, but some things we can control. And the things that you can control, do your best to control them.